Hi everyone, welcome to another exciting series of SYNLAB Podcast. My name is Uchenna Amadi and I'll be your host. Today, SYNLAB brings you a full package on improving reproductive health, strategies for optimal fertility. Please do not forget to like, subscribe, share and follow SYNLAB Nigeria on YouTube and Spotify. With me here today to discuss the first topic, which is understanding reproductive health and fertility, are professionals who have brought their expertise to the table. Before we proceed, let's meet our esteemed guests. The first guest is Dr. Babatunde Ogunniran. Hi, Dr. Babatunde
Hello,
Ogunniran.
thank you very much for having me
Nice to have you here.
Yeah, thank you. It's all my pleasure.
So I'm going to be reading his bio, his exciting bio. He is a distinguished consultant gynecologist and fertility specialist. He graduated as a medical doctor from Ladoke Akintola University of Technology in 2008 and achieved his fellowship with the Medical College of Obstetrics and Gynaecology in 2018. With a deep commitment to reproductive health and infertility management, Dr. Ogunniran is dedicated to guiding couples through their journey to parenthood. He is an active member of the Society of Gynaecology and Obstetrics of Nigeria, the Association of Fertility and Reproductive Health, and the European Society of Human Reproduction and Embryology. Currently, he serves as the head of clinic at Bridge Clinic in Lagos, Nigeria. Wow, Dr. Ogunniran, this is quite impressive.
Thank you so much.
Again, it's nice to have you here.
Thank you so much. It's my pleasure.
And we also have Dr. Emeka Philip Igbodike, who is an obstetrician and gynecologist with extensive expertise in his field. He holds a medical degree from Nnamdi Azikiwe University and is a fellow of both the West African College of Surgeons and the Medical Postgraduate College of Nigeria. He earned the prestigious Omibodun Prize in 2019 and was invited to present at the FIGO 14 Scientific Conference in Paris in 2023. Wow. Dr. Igbodike is currently a consultant at Kelina Advanced Minimal Access Surgery in Victoria Island, Lagos. He has over 45 published scientific papers and serves as an associate editor and peer reviewer for several international journals. Additionally, he's an editor for the upcoming Punchline textbook of Obstetrics and Gynaecology. He is passionate about research, public speaking, and systematic reviews. Dr. Igbodike is pursuing an MBA with a focus on sustainability and development at Nexford University. He is also dedicated to volunteering, enjoys nature, and is an avid boat sailor. Wow. He is married to a consultant ophthalmologist, and they have 3 children. Dr. Igbodike, firstly, you're welcome to this SYNLAB podcast.
Thank you so
much.
much.
Might I say that your profile is very powerful? Yay!
Thank you.
Only you.
Thank
It's nice to have you all here
Thank you.
today.
Thank you so much. Thank you.
Okay, so as earlier mentioned, in this episode, we'll be talking about understanding reproductive health and fertility. And I'd like to start with Dr. Igbodike. I'd like to ask, what is reproductive health? And why is it important for both men and women?
Okay, thank you so much. And thank you, viewers. So we are looking at reproductive health. We're going to give a definition, which is functional and precise. So we said that reproductive health is a state of complete physical, mental, and social well-being that is related to all the processes that has to do with reproductive system and not just mere absence of disease or infirmity. And also it has to do with all the reproductive functions and also the processes. Now, reproductive health has a lot of components which we are going to look at with the,
Because I was going to ask.
Absolutely,
that,
yes. So in terms of why is it important? Now, when we talk about reproduction, we are actually talking about the duo, which is the male and the female. But most of the time, the emphasis is on the female, where we are talking about the issue of the sexual health, We are looking at the issue of cervical cancer, among others. So, and also even violence against reproductive, and sexual issues in the female. So, why is it important? When we are talking about the male and the female and the reproductive issues, it's important that every woman or every couple should know when and if they want to actually reproduce, when they want to reproduce, and how they want to reproduce. Okay, and in terms of duration, they need to space it. And of course, when we're talking about the sexual function, they should be able to enjoy it to the fullest and not necessarily having maybe something like pain during, sex and all that. So all these things will be looked at. And each time we talk about this, we are also looking at when you are saying the timing, if that is, I might say, I don't want to reproduce, okay? We are looking at the issue of using of contraceptives, okay? Now, those modern contraceptives might say, I want to produce in the next 2 years. They should be freely a choice for the female or for the, spouse, as the case may be, or the male or the female. Then after doing that, I say, okay, right now, I want to continue to reproduce. So all these function and processes should be something that they should freely decide and without any coercion. So I'll stop at this point so that we can...
So I think just to add to that, the freedom to choose is very important.
Yes.
And, when we move further in this podcast, talking about the aspects related to fertility, it now becomes a challenge when you now choose to get pregnant and you are not getting pregnant. It now becomes a bigger issue. So I think we'll still look at all those aspects. And that freedom to choose is what is important. When I'm ready to do it now, or we're not ready now, want to wait for a while, what are those aspects and how does it affect the couples? I believe it's something very, very important that a lot of people are also not paying attention to, even in this part of the world. And I think that is what we're really going to talk about today.
So when Dr. Igbodike mentioned something about especially women, I wanted to ask, because we had another podcast where we talked about DNA testing, which if you have not listened to, by the way, you have to go and listen to it. So we talked about, somebody mentioned something about when fertility comes into play, is only the woman. Please, let's trash it here now, so that they will know that it's both gender. It's not just the woman, because as far as I'm concerned, the woman may be good to go and the man may be the issue. Okay. So I want you to use this medium to debunk it, so that the society does not always point their fingers at the woman each time it comes up.
Okay, so when we talk about reproduction, and its systems and function, where we say the women is this, I will give a simple scenario. Fertility. All right? The man just deposits something. It is the woman that will get pregnant, carry the pregnancy all through 38, 40 weeks. Is the woman that will deliver. We are still talking about the woman. Is the woman after delivery, is the woman that may, God forbid, have complication. It is still the woman that will take care of most part of the baby. The man just comes in and goes, all right? So most of this process is actually centers on the woman. The man, yes, is important, of course, but we must let the truth. And of course, it's the woman that has the uterus. The man doesn't have.
So that's the part. That is the part that I usually disagree with as well, because as a fertility specialist, we attend to couples every day, countless people, and usually they're coming for a place of pain. And because the stigma is just on them. They get married and parents are already expecting when she's going to have a baby bump. But sometimes you'll be very, very shocked when the man comes in alone for a consultation. You know that the man is the problem.
Thank you.
All right. Because so I say treating women or treating couples over the years as maybe understand that, look, you are in this together. The fact that it's the woman that has an issue doesn't mean you might not have your own issues as well. So we need to manage you as a couple. So the fact that we're focusing on the woman, we know she's the.
Thank you.
I always say, and they say
for fighting my battles.
The woman is the weaker vessel, but no, the woman is the stronger vessel because she has to carry that pregnancy.
Thank you.
She has to be the one to take injections. She's the one that will go through the pain of delivery. The man is just rubbing her back and saying sorry.
Exactly.
And the woman is in pain.
She
goes through labor. She's still going to breastfeed her baby. I think I was even mentioning yesterday that I wish I could even breastfeed as well, just to try and
help
support
the
and help them.
pain.
But
Yeah.
the society needs to change that aspect,
Yes.
and I think we also need to change that aspect where we're just focused on the woman.
Yes.
So even when you talk about reproductive health, it's both the woman and the man. So
Yes.
there are aspects that you need to look at for the man and say, okay,
Yes.
you need to be on supplements, you need to watch what you're
Yes.
taking. You're going through a fertility treatment, you're saying the woman should be doing what she's doing, but the man can continue taking alcohol and smoke because it's fine. No, it's
Yes.
not. It's not.
Okay.
Wow. So speaking of, because I was going to say that because he said the man just deposits.
Yeah.
What if he's depositing
Yeah,
what is not there?
blanks. If he's shooting blanks.
So okay, maybe let me.
I didn't want to put it that way.
Yeah.
Let me tweak that a little bit. So why I said that it centers mainly on the women is because we are looking at the man from the angle of support,
Okay.
but in terms of the processes, it is still the woman. Okay, so like for instance, during pregnancy, the man gives support. The man doesn't have morning sickness. He doesn't vomit. Nothing. He's just there. Okay. So in terms of the man is just giving the support to the principal. So I'm saying that the woman is the principal. Yes, of course, the man has a role to play.
Okay.
But during delivery, the man is also on the outside. It is the woman that will still push.
See, Dr. Igbodike, we'll take this thing out of the after now.
Thank you so much.
After now. So,
Okay.
but before, I would like to speak to Dr. Ogunniran on this about fertility. Can you define fertility and the signs of fertility issues in men and women?
All right.
Yes.
So fertility basically just means the ability to reproduce. All right, at when you want and how you want to do it. So if couples meet together, all right, the just ability to reproduce is what fertility basically means. And that now brings us to the concept of infertility, which
Yes.
means that inability of the couple to achieve a conception or a pregnancy within a year, all right, of the consistent sexual intercourse. So if they've been meeting for a year and no conception is happening, then there must be a problem. All right. So most people, of course, I attended couples before that within 2 months of getting married, they're already agitated, and sometimes they say just take time, just give yourself
relax.
time. The anxiety is putting so much pressure.
Yes.
So if after 1 year you have not achieved conception, and especially for the woman that is less than 35 years, all right, then you need to start looking for avenues to see what is going on. And of course, what are the things that we see sometimes that could maybe put us or point us to say that there may be issues. For example, a woman not seeing periods regularly.
Okay.
It's something you need to be worried about,
Yes.
all right? Or you start noticing that, you're noticing your tummy swelling, there's something off about you. You're feeling hot when others are feeling cold. It could be telltale signs of some things. Or for the man, for example, you discover that, this erection may not be coming up, all right? It's also a challenge.
Yes.
And that's why I say we don't focus just on the woman alone. For the man, you notice that something is happening, either you're not sustaining an erection or you're not feeling aroused or what is going on. Or for the woman, you're having heavy flus, heavy periods, or you're having bleeding in between your periods. It could be telltale signs of something going wrong. So sometimes they are not all explicit enough, but by the time you start saying, we've been trying for about a year, nothing is happening, then you need to start looking for support or looking for help.
Yes, and I also want to add something. You mentioned the issue of the age or the
Yes, I was going to ask about
35
age.
years. So for a woman that is 35 years and beyond, you may have to come in earlier.
Yeah.
6 months.
6 months.
Okay.
All right. You might not have to wait for a whole year
Okay.
for you to do that. And again, we talk about the issue of adequate sexual intercourse.
Okay.
So people say, what is adequate? What do you really mean by that?
Okay.
Is it every hour?
every day?
So every day,
Some people ask, is it food?
So usually, out there, the gynecologists, we believe that we can define adequacy at least having 3 to 5 times of sexual, of course, unprotected sexual intercourse in a week.
Okay.
In 1 week, all right? I remember saying this thing in clinic, the woman will just shout, wow. I just said 3 to 5, so what is it?
A client once said, doctor, that's work. I'm like, it's work.
Yes.
But you want to
Wow.
get pregnant.
Exactly. So this is very, very important because most people have the issue of what we call mistiming.
Okay.
They are coming to you, they cannot get pregnant. So, madam, how often? Say, well, the last time I met was a month ago. I said, come on. How will you do that if you're not having adequate sexual intercourse?
Okay.
Of course, unprotected. So you cannot use condom and you
Yes.
want to get pregnant.
Yes.
Thank you.
Okay, so the lifestyle choices that impact infertility. I know we've mentioned age, so that if you're up to 35, you have to coming earlier.
Yeah.
So what are the lifestyle choices that people can...
All right. So age is a major factor. You mentioned that earlier because it's sad as well that they focus on the woman here as well. But the truth is, a lot of things are coming to the man as well.
I'm tired.
So the truth is, right now, for the men as well, a lot of people don't understand that. But the age factor is also setting for men as well.
Wow.
The older you get, the poorer your semen parameters.
Absolutely.
All right. A lot of environmental factors affect that. What we are eating, which are the lifestyle things as well. What do we eat? A lot of people just eat junk foods.
Yes.
A lot of cholesterol in your body system is affecting your body system as well as it is. Sometimes the job as well is a lifestyle. Sometimes you tell some people you have to change your job. All right, where you have to be exposed to radiation, all right, you have to be exposed to X-rays all the time, and you're not protecting yourself, or you're working, even those working in all these oil companies, all right, all these things with radiation, petrochemicals, they affect the quality of the parameters in the body system. So these are lifestyle changes as well. Weight as well is a big issue where a lot of people don't pay attention to the fact that it means I'm living fine. I look good because that character of I'm looking
I look good.
But it's very, very bad because obesity, which is a challenge, also has a lot of impact on the hormones for the woman, all right, ability to produce quality eggs, and also for the men as well. For obese men, it's been shown that they have very low semen parameters as well. So these are lifestyle choices. Alcohol, smoking, all these have been shown to have an impact on the reproductive health system.
Thank you very much. And this has been very, very informative. Dear listeners, remember, knowledge is power, so let's stay informed. Do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and Spotify. Make sure you join us in the next episode as we dive deeper. Stay tuned and see you soon.